ready.
All right.
I know Sabrina will not be attending, and we heard.
Dr. Wright?
Thank you. But we do have a quorum. So the first move is approval of the minutes of the 16th. Receive these email, any additions, corrections? The only correction I found was the date of this meeting was the 20th, not the 19th.
I'll do that first. Sorry about that.
That was the only correction I found. Is there a motion to approve?
So moved.
Second?
Second.
All in favor?
Aye.
Aye.
Opposed? Okay, motion, minutes are approved. We now have two new board members. Mr. Mark Broker, who is filling out the remainder of Bob Connington's term. And could you tell us a little bit about yourself, Mark?
Yeah, so Mark Broker, I work at Neighborhood Health Center, work in the HR department there, do a number of other things outside of that organization through volunteering and board president of Birth 5, and just a number of ways. Also my wife, and now 17-month-old, so we're rooted here for sure. And then no one ever tells you when you have a 17-month-old how fast life is going to move. It's all been a blur. And I'm excited to be a part of this for the next chapter and whatever we decide and move forward to help Wayne County.
Well, welcome.
Thank you.
And our other new member is Dr. James Swander, who is filling out Dr. John Eagleman's term.
Yes. I'm a retired physician from the staff of Reed Hospital, and where I started in 1979. And I have some experience with medical board there, but I was not very politically inclined or ambitious, so so I waited till I retired to volunteer for the position that I'm filling now. I'm married and have a family, but they, like so many of us, they've grown up.
Well, welcome. Health officer report. Becca's going to have to fill that.
Yeah, I won't do nearly as great of a job as Dr. Jetmore does, but we have had no new deaths as far as COVID goes. Over our 7-day average for Wayne County, we've had a total of 2 cases for that 7-day rolling average, which is an increase from the 7-day rolling average previously. For other respiratory illnesses, as far as flu and RSV, things are decreasing. So RSV hospital admissions were down about 2.5%. I'm not sure. There we go. So RSV is down about 2.5% since this time last month, and then flu is down about 10% since this time last month, so significantly less than we were last month. I know last month we were talking about everything being so much higher, so it's nice to kind of see some of those numbers coming down as far as those respiratory illnesses are going. Recently, we've been talking a lot about a new rabies that's going on. There was a positive skunk rabies in Clark County that's kind of becoming a concern because of the interaction with skunks and, you know, common animals that we have, cats and dogs and things like that. So that's something that we're kind of talking about, being aware of and watching out for in the health department. There's also a rise of syphilis across the state right now, so that's something that we're kind of aware of and looking out for, doing extra testing and education and things like that. Across the state, childhood vaccination is down. However, as a county, we are doing pretty well. We're seeing our vaccination rates at our mobile units a little bit, or our mobile clinics a little bit lower than typical. So we're kind of extrapolating some data as far as right now we go to Fountain City, Hagerstown, Cambridge City, and why am I drawing a blank right now? Anyway, we go to 4 different locations. Oh, I'm sorry, the other one's a roaming clinic.
Yeah, okay, that's why we couldn't figure that one out.
And our numbers are down, so we're kind of looking at some data, seeing maybe we need to change the times, maybe we need to change the locations, see if we can service people better. I think the numbers are going down because of the seasonal vaccines, and people already have their seasonal vaccines now. But we're going to do what we can to try to kind of figure out how to make sure that we're serving the public best. Legislative updates. There's been a lot of legislative updates recently in public health across the board. We are, let's see. I should necessarily go through all of the septic ordinance has been ebbing and flowing. I think they have finally settled on something that I know that Dan is pretty happy with. I thought maybe he was going to come talk about it today, but maybe he's running a little bit late. I know that child-operated refreshment stands is one of the legislative updates. The gist of that is essentially that if it's a child-operated refreshment stand, there's not super strict health department-related requirements as far as sanitation and things like that. There's some county contracts. The county executive is the body charged with executing contracts for goods and services on behalf of the county in certain exceptions. To talk a little bit about a review process. We're going to talk a little bit about updates with our contracting process today. There were some mobile retail food establishment legislative updates that will begin in January of 2025. So we'll probably go over those with Dan as we get closer to that time frame. And then, let's see, for trauma-informed care, there's going to be a nursing study required, so that's kind of a cool update. Some updates with disasters and emergencies that I'll probably let Dan speak on as well when he's here. So that's it for legislative updates. Does anybody have any questions on any of that stuff?
On immunizations, how about childhood? Are you seeing a drop in kindergartners getting the required immunizations?
Not for us specifically. Across the state it is dropping, but for Wayne County we're doing pretty well and we're staying pretty steady overall. I'm not sure exactly what's causing the change across the state, but I'm happy that we're staying consistent. I don't know if maybe we're just behind a little, you know, if there is something that's causing a decrease, maybe we're behind the curve with the entire state, but as of right now, as Wayne County, we're pretty steady with our rates.
Any other questions before we go on to your report? Okay.
I know that Mark wanted to make a comment earlier in the meeting. Mark, do you want to go ahead and say your piece? I'll give you an opportunity to do that.
I'm Mark Holscher, County Auditor, and having dealt with the health department since in the last year, I will say that I have nothing but admiration for the two ladies down here, and what I'm going to say to you is not a criticism of them. When I first came to office, it became pretty clear to me that things were different than when I was first here. And I asked to hire somebody that would help me through the financial situation with the county. And it's called Hartman and Hartman. And they were a great help to me. I am suggesting that the Wayne County Health Department look at hiring this particular group of people. One of them was the head of, or worked for the State Board of Accounts. The other one was with the State Board of Tax Commissioners. At that time, that's what we called it. Both of them have a great deal of understanding of budgets, of how county government spends money. And I would suggest that you look at hiring this particular group to help the Wayne County Health Department manage grants, money, and meet State Board of Accounts guidelines a little bit better than what they are now. I don't think with the staff that they have, they're giving it everything they can. But just like with me, I needed help, and I think your department needs help. And I'm suggesting that you look at the possibility of having these people come in and help them. It would in fact help me, but you have lots of areas of concern that I have that you're not currently addressing, and I'm not too sure that even I can help them, because we've had a great deal of discussion, and I don't think that I can do the job that they need to have done, or this other outfit can. And that's why I'm here today, and I would like to answer any questions you might have, but they need some help. The direction that they're going is the right direction, but it's not enough. So if you have any questions, I'd try to answer them, but again, this is not a criticism of these two ladies.
Hartman, H-A-R-T.
H-A-R-T-M-A-N. It's the same group I had come in and help me.
Are they based out of Indy?
Pardon?
Where are they based?
Kokomo, someplace around that area, south, I don't remember.
Okay.
The lady that we had come in, named Donna, was with the State Board of Accounts before she moved to this group. And when my understanding of what they can do is something I think they can help the health department with. You're expanding, you're getting more money, you're getting more grants, and you have other personnel things that you're gonna have to deal with. But this lady who works for them, who came in here, helped me a lot. And I just think that in looking at your situation with money and grants and staffing in your department, I think something like somebody like this in this company would be a great benefit to you and to them. So if I'd be glad to talk about them to some extent. I'd be glad to answer any questions you might have as to my reasoning. But I think my suggestion warrants some consideration on the part of the board.
I guess my initial question, the scope would be what, to assess and then
No,
your
she
take
will
over?
come in and she will guide them as she goes through. She'll pick issues. She'll take a grant, make sure that everything's proper with it, and suggest how it might be changed. She's very, very specific oriented. It's not, well, you should, and here's what you're doing, and here's how you should change it. But it's not that way. And I think that would be a benefit rather than just coming in and saying, this is something you ought to do. But she will go through it, and at the time she finds an issue, she'll address it. And she hopefully will communicate to me various things that she finds in regard to money. Does that, if that answers your question, but
I guess I'm still a little unclear about whether they're advisory role or they're actually taking over the operation.
oh, they won't take over, no, it won't be that at all. It'd be an advisory role.
Okay.
It's somebody that they can rely on to help them when they have questions. And they've had a lot of questions. So it's just something that these people, they can lean on them and look for answers. And hopefully it will help them answer things a year from now and produce some understanding of the budgetary process, the grant process, and help them do a better job.
I think this will serve like that with consultation.
Yes. And
They'll come in and take a needs assessment, SWOT analysis, find out exactly how to logistically establish the inner workings of the department, and then stay around to help monitor and see things through.
it is somebody they can go to answer questions that they have, that in questions they're giving to me, I can't always answer them because I'm not too sure, but again, that is something that we need to do from my perspective, and to correct errors, to correct procedures, and I'm not the one for them to look to correct those.
I think this one they've been relatively cost efficient for the services they provide to all the county.
Pardon?
I'd say this one they've been cost efficient. The expense has not been great.
They helped me immensely when they were here. There was no end to what they helped me with and could help me with. The process of money is not something that's stagnant. It goes on and questions come out all the time. And in dealing with them, I just felt like at this point, they needed some help. And it's just, there is a certain amount of chaos in your department that I'm sure you, as you know, you're aware of, and trying to put that, press that down to where they can do a job that is more beneficial to your department. Because I think right now, in talking to each of them, they have, and you could, ask them whether they would recommend that somebody help them. I'm just recommending it, and it's up to you people, but ask them. I'm sure they'll tell you, or I hope they will.
And I assume Becca has the contact information.
Some of it, I've got to pull some more out and get that to them. I wanted to talk to you before I started that process of pulling all that stuff out, because they need some help.
Well, I think you can get them the contact information. That's something that we can review and discuss.
That's fine. I'm just suggesting.
Okay. Thank you, Mark.
Okay.
Any other questions or anything? All right. So the first thing that I have is the AmeriCorps MOU. I have an AmeriCorps member that I've been assisting and hosting, and it is an MOU that I'm asking for retroactive approval for signing because I signed it already. It was to allow the AmeriCorps member to participate in the syringe exchange program, because it is part of the requirement for them to be able to do their AmeriCorps internship, I guess is what it is. So I did sign it, and so I'm asking for retroactive approval for that. And I don't know,
What is required of the department?
Just to host this AmeriCorps member. So he
Okay.
comes on Tuesdays to the Ceramic Exchange from 11 to 1 is when that is on
Mhm.
Tuesdays at the health department.
Okay.
And I don't know, have you guys received a copy of the MOU? Is that the paperwork today?
I'll see.
Okay.
I don't know if it was
Is there any
or not.
financial?
No, we're just hosting, so
Okay.
he's with Bridges for Life is the person who pays, there's a fee that they pay, and
Okay.
there's a harm reduction component requirement of his partnership with Bridges for Life, and so he comes to us for 2 hours a week to be able to meet that
I assume
requirement.
he's signed a confidentiality statement.
He has, yeah. Yeah, and I think it would make sense for me to get you the MOU before you guys approve it, so we can kind of do that at the next meeting.
And do they do background checks and all that kind of stuff prior to them being involved with them? Is there any of that has to be done?
I'm
or
not sure, but I can find that out.
So you'll get us the MOU and then we
Yes.
can
Mhm.
discuss it next meeting.
Okay, so the big topic today is Health First Indiana updates and contracting. So Dr. Jetmore and I and Jeff met with the Mobile Integrated Health or Paramedicine Program with the Richmond Fire Department. We met the new fire chief and his staff and kind of talked about what that partnership is going to look like with our Health First Indiana funding that we have. Originally, we had agreed upon an amount of $140,000 to expand their program from services just within Richmond to service the entire county so that we can serve people in Cambridge City and Hagerstown and things like that who are in some sort of crisis that might not be appropriate to go to the hospital or go to the jail. So maybe like a mental health crisis, for example. So like I said, the original agreed upon amount was $140,000. And we, in this meeting, discussed modeling it similarly to the interlocal agreement that exists between the county and the city, where the city currently pays fee for service to the county for, I'm sorry, the other way around. So the county provides the service and the city pays the county. So we're flip-flopping it the other way around. So we would be paying them for service, whereas with the 911 interlocal agreement right now, it's the other way around. So rather than giving them the lump sum of $140,000, we talked about fee for service. So they would essentially send us like a bill every month, so we kind of can keep tabs on what the money's being spent on and things like that. Other things that we discussed were what exactly we would be paying for. So we talked about salary and benefits, supplies, the location, which is still being discussed. And then we discussed the vehicle for the new employee or new employees. And we kind of talked about how that vehicle has to be outfitted for emergency capabilities, and it might be an option to use one of the old Sheriff's Department vehicles and transition it over to a mobile integrated health or paramedicine vehicle, which would be a cost savings. The original budget that we received from them in the fall of last year, I guess, was the entire department budget for 2024, which was not clear. So we talked with the supervisor of the program about breaking it down kind of per person to have an idea of what those costs look like for the entire year. And that's kind of where we're at right now, is waiting to see what that looks like. So we have some anticipated expenditure numbers per month or, you know, per quarter or whatever. We discussed that it likely will be more like one employee versus 2 employees, but I know we had kind of talked about that before, as far as $140,000 and affordability. I'll stop there. You guys have questions about the mobile integrated health?
Okay, so instead of giving them a lump payment, they're to bill.
Yeah.
That is our estimate of what is that not to exceed that 140,000?
Yeah, so that's what they're working on. The budget that we received in the fall was $826,000, I think, for the year of '24. But that was for 5 employees. And we didn't, it was not clear on that budget. It was tiny print and there was kind of some confusing boxes all over the place. And so we asked them at this meeting that we had to kind of rework that, make it a little more clear, and then make it a per person breakdown. So we know what is it gonna cost us to fund a new position or a new position and a half to 1.5 FTE, something like that. So yeah, we kind of we've sort of given them the idea of this 140,000, and then we're asked them to give us the budget for what it might cost, knowing that they're not.
We don't have that yet.
No, we don't have that yet. I don't know. No, I haven't received it. Jeff, have you haven't received anything from them?
No, we haven't.
Okay.
So is there any action we need to take at this point, or is this just for information? It sounds
Just
like
to kind of keep you guys updated
yeah,
on
it
what's
sounds
going
like
on
it's
there.
just, you'll get back with us when they actually have a final proposal.
Yes.
Will the relationship be directly with the county or with the county and the health department? And will it be evidenced by some MOU or?
Yeah, so it would be the same type of contracting that's with the contract proposals that we're gonna go over kind of in the next step of the meeting. And one of the things that I kind of wanted to gauge your guys' feelings on is, should the paramedicine program also fill out kind of the same application materials as we're gonna have everyone else fill out in order to apply for some of this other funding? So the state has, a work in progress, kind of been informing us that there is a 30-day requirement to post these requests for proposals for working with any partners and funding the uplifting of their program with the Health First Indiana funding. And so they've recently created this portal that is a public place for us to post our requests for proposals, to be able to kind of put them out there for 30 days. And that went live just this month. And so I was gonna kind of see what your guys' thoughts were on if you thought that it was appropriate for the paramedicine program to also fill out the application. It was a line item in our budget before, so I'm not sure that it's necessarily a requirement.
What would be the benefit of having that program fill out?
Just for consistency's sake, I guess. I'm not really sure if there's any legality to it, or do you have any input on that?
I'm not familiar enough with it to have an intelligent comment at this point.
We could we could or would still expect, say, reporting requirements, right?
Oh, yeah, there's definitely still reporting requirements.
I mean, I would say actually it's probably gonna be a little bit more involved than some of these other contracts because of the fee-for-service model that you guys were discussing, that you're gonna have more data.
Yeah, potentially. There's
Okay.
quarterly reporting requirements is kind of what I've written into the request for proposals across the board. And I anticipated having them kind of work the same way.
Mm-hmm.
And we'll be using some of the new state money to fund this. Makes sense if they would.
Yeah, it seemed like they would probably want that requirement. I don't know. It seemed like they would. It seemed like the state would put that guidelines out there for that as part of the.
I don't know what we're looking at, but
Maybe not. State always does things nice.
What about if you look under page 7 on the pink one, it shows programs, projects, which will not be included, and then if you go to the next page, it does say vehicles.
Which page are you on? I'm sorry.
It's page 7 and 8 with the pink tab one. So
Okay.
that may
This is a kind of a working draft, so this
Okay.
is kind of just something that I've been working on.
Okay.
So that's something that we can take off of there. I'm
Oh.
mimicked Hamilton counties.
Okay,
Um,
so this isn't from the state?
No, yeah,
Got it,
no.
cool, okay,
Um,
okay,
Yeah, we can use funding to purchase vehicles.
okay. I just wanted to be clear before we.
Yeah, I'm glad you said that though.
Mhm.
I just don't know if it gets confusing with requiring the same process of them. Given that council approved the budget with the line item, the
Mhm.
state approved the budget with the line item.
Mhm.
So really, I'm just asking what you guys would like in terms of kind of creating that foundation with them.
I would say if we didn't do this, we would need to, if we didn't have them do the process, it would need to be something very similar.
Okay.
Ideal, wouldn't you think?
Probably.
Possibly. So all of the information that we're requiring,
Right.
we would want.
I can kind of work up something that I think.
When will the award be granted?
So we've got a timeline, and actually, it's a pretty smooth transition. That's the next kind of thing that we're talking about. So if you go to, in that same packet,
Didn't look like the blue one.
June 1st?
oh, the blue one you said?
Well, is the blue the example of the contract proposal?
The blue is the budget.
Okay,
Is
sorry.
that, okay, yeah. I
So what
think
do you
we're-
want?
Pink one. Yeah, okay, pink one, page 5.
Okay,
Okay.
yeah. We appreciate the colored tabs.
That was actually Angie, that was her idea.
Okay, great.
November
Whomever's
December
idea is
9th.
fabulous.
I was out for a day, we come back and the tabs, but they are nice.
Very nice.
So this is kind of the time frame that I've come up with here on page 5. Because of the 30-day posting requirement, I was kind of thinking, anticipated, get it posted March 1st with a review period of about a month. I don't think we necessarily need quite that long. And that is what the reviewer document is for, which is maybe the yellow one, orange one, where are we at here? Yellow. So that's what we would use this document for, and kind of assign a team to review the applications.
Mhm.
And then notification of award would be May 1st, and then contracts issued for signature period is May 31st, with the award period beginning June 1st. Did that answer your question, Ron?
Now, but does the paramedical program really fit this model? We're talking about this.
Not the time frame necessarily. I think we could probably move things more quickly than that, depending on how quickly they get things back to us.
But it's already gone through our budget prior to this.
Right.
Mhm.
So it's not really an award, correct, at this point?
Not in the same way that these are, no. They're not applying for it in the way that these are, no. But they do have to meet the core services. They have to meet the KPIs. They have to do the quarterly reporting. And,
So we would need to kind of modify it
I think so.
This
That would be my
for that.
suggestion.
Mhm.
to fit that unique situation.
Mhm.
Yeah, 'cause that's almost separate.
Okay, that's something I can start working on, bring to the next meeting. So the 4 Health First Indiana request for proposal documents that we have here are the grant program guidance packet, which is the pink tab. And then we have the KPIs and metrics, which is the green tab. So this is, pink tab is overview of Wayne County's program and how everything's gonna work. Expectations for reporting, core services, we're hoping that they'll help us with things like that. The green tab is kind of more specifically what the state's requiring with the funding. In terms of the KPIs, the metrics, things like that. Then there's,
Nothing I haven't found it. The other green?
Yes, it's like
You're
this.
special.
maybe you missed one.
I'm ready to colorblind.
Is this the green?
There's a green, there you
Oh,
go.
duh.
Okay, this is tiny.
There you go.
Listen, I've got extras.
Excuse me. I failed hard.
So we got the info packet, then the KPIs, then we've got, there's an itemized budget that we would ask them to complete, so we kind of can anticipate what they're gonna spend their money on, should they receive an award from us, that's the blue tab. And then, finally, we have the reviewer guide, which is the yellow tab, so that everybody on the team that we decide, is able to kind of use the same uniform process to review
Got it.
applicants.
That's a good idea.
Mhm.
So that's what I have drafted so far.
And you said it's based on what? Hamilton County?
Yeah, Hamilton County shared their contracting documents with me.
And are we gonna have like pools of money for different KPIs or?
So originally we had about $340,000 put aside for, it's like, 2 health educators and, I don't know why.
Community health worker.
Yes, the community health
School
worker, yes,
liaisons.
yes, from
And
that.
then the FEMR
So
position.
that's separate,
That's
totally separate, yeah.
Okay.
That's what the Community Health Coalition kind of discussed, and
Mhm.
as so many things have happened over the
Mhm.
last 4 to 6 months,
Mhm.
we've kind of decided that that's not necessarily the way we need to go, and so essentially we have this pot of money that's been allocated towards contract services that will help us to ensure that we are reaching all the KPIs. And so within the pink document, I have listed, these are the KPIs that we're not reaching. So I kind of had to go through and look at every single detail of every single KPI to see, you know, what are we already doing? What do we not need people to apply for money for? I mean, it's a huge portion of it. I would say maybe 65 to 70% of the KPIs we are already doing in-house.
Mhm.
But this pink document only has information on the things that we really need people to help us with and apply for, which was different from Hamilton County. So they had, you know, they need a lot of help with immunizations. We do not need that.
Right.
We're doing really well there. But like trauma and injury prevention, we need a little bit more help there. So that was something that I had to add a little bit more information on there.
So on page 2 is where you listed the ones where
Yes, yeah, that's one of the areas.
Yeah.
the areas that we're going to help.
Yes,
fill.
yeah.
So would we put a cap for each organization or for each grant person? Or would we
I don't know.
say we're gonna apply, you know, a certain amount of money, I don't know?
Mhm.
Or people can just bring in their proposals?
I haven't seen, I think the state developed the contract portal specifically for us,
Mhm.
because I'm on the core leadership committee, and I've
Cool.
kind of said, this is something that we need with this Indiana code requirement.
Yeah.
And I don't have anything like this, and so I think no one else has posted a contract on there yet. I think we may end up being the first people to do that, so I'm not sure if there's a function within the portal that you can say, this is the cap that you would be able to receive, but it's certainly something we could put into the document too.
Just kind of, you know, brainstorming or curious kind of the, how
Yeah.
it will be, how that will be awarded or.
Yeah, my only thought is, I think there are some agencies that may, be able to service multiple
That's what I
core
hope.
Yeah.
services.
Yeah.
Mhm.
I think so.
So I'm not quite sure. What are your guys' thoughts on how to kind of,
I mean, do you advertise that you have X amount of dollars and say, bring us your ideas, your best ideas? Community?
what about if we asked for the budget later? Kind of asked for the proposal, what they hoped to be able to do. Is that something that you guys think would be realistic?
Well, I think one thing is, it'd be nice to know exactly what's the total amount we're gonna be able to grant.
Mhm.
And then I
Yeah.
think we need to establish priorities
It d-
on which are the most important or most needy, and then we may have to allocate a percentage to.
Right,
to that.
right.
Mhm.
And then, I would assume if I was on the other end wanting to write it, I'd want to know how much they can ask for, or what the limit is.
Yeah.
Is there any priority in any from, as you see things, or staff see things on these in terms of implementation or need?
I think we need a good amount of help with the student health. I think really we could do the chronic disease prevention, access and linkage to care, fatality prevention initiatives, and the tobacco prevention cessation. So, and maternal and child health. So I think student health and trauma and injury prevention are two of the big ones.
So I was thinking if those were very high priority, then maybe you could try to get proposals for those and see kind of what that looked like, and then from there you could see then what kind of funding might be needed to support those requests or something, and then from there you could see what happened with the rest of it. I don't know, that's one thought.
Just to give you guys a reference for the dollar amount, the total funding that we have for paramedicine and the other programs is $356,218. However, there are some things within our whole health first Indiana budget that I think are changeable. For example, we found out a few weeks ago that the lead grant is not going to renew. It's going to go away. And we had kind of worked some things into this that supported that grant as well. So I think that things might change a little bit given that program changing too. I also think that we put a lot of office supplies for those contract workers we thought we were going to have in our building, upwards of $10,000. And I don't think that we're going to have those people in our building. I think we're going to, be supporting them outside of our building. So we're not going to have to purchase those office supplies. So I do think these numbers can be adjusted a little bit.
But the 356 that you mentioned, the 140 that we allocated would be reduced, yeah.
It was within
subtracted
that
from
number, yeah.
Okay.
Yeah. So there's kind of a lot of moving pieces right now.
It sounds like it.
Yeah.
Sounds like you have a good understanding of it though.
It helps being on the state team. So if you kind of want to look over that, we don't necessarily have to post anything by March 1st, but to be in line with this time frame, and to meet the 30-day requirement, we would.
What do we need to do to be ready for that if we were going to shoot for that March 1st timeline?
We would have to, you would have to approve a document that is a request for proposal for me to be able to post onto that portal. That does not necessarily have to happen today, so I can make some of the edits that you suggested. I also think that we need to decide on a timeline too. And one of the things I wanted to talk about just on my agenda here is for the award period, we know with the legislation for SEA 4 that we've got secure funding through the end of 2025. So for these proposals, we kind of have the option of providing these awards through December 31st of 2024, which would be a 6-month award time frame, or given that the legislation secured the funding through the end of 2025, we could make it an 18-month contract. That's something that I think we need to kind of talk about and think about before putting the request for proposal out.
It doesn't seem to me that we're going to be ready by March 1st to do that.
Little pieces.
Yeah.
I would recommend the 18-month time frame. I think that makes the most sense. I think a 6-month award period is quick.
Back us up for 2025, you have twice as much money as you have in 2024,
Yeah,
right?
yeah.
So,
Mhm.
So then we could kind of add on more options.
you have more that you could contract for.
Better idea what the need is after that. Services.
It sounds like the consensus is that we kind of look at 25.
Yeah, that makes a lot of sense. 18.
Okay. Still comfortable with that?
Anybody have a contrary opinion?
And I think we were looking at doing something that would be, from an agency standpoint, better that way too, in terms of 6 months versus 18.
So what do you need from us today to move forward? I mean, a lot of work's gone into these forms.
Yeah.
And they look really pretty thorough.
I've had a few people kind of help me proofread them. I think that maybe some more time for you guys to review them, if that's what you'd like to do. Approving the time frame would probably be helpful. And then sooner rather than later approving the documents themselves to be able to be posted on the portal.
You say the state is gonna provide an RFP template, you think?
They have provided us a guidance packet, but not a template. This is the RFP, essentially this is an adjusted version of the RFP from Hamilton County.
Is there templates already in place for the county or anything that could be used for this?
Pardon?
Is there a template already in place for the county that you could substitute some of the language?
That I'm aware of.
Not for these kind of services.
Well, if an agency goes, for instance, let's just say that we wait till our March meeting to approve all this. I think that moves the whole timeline back.
Oh, yeah.
Because an agency wouldn't have time to get a proposal in by April 1st.
No way, yeah.
Right.
So I think with the view that if we're looking to approve all this paperwork at the March meeting, then I think that moves everything at least another month.
Yeah. Mhm.
But if we're doing an 18-month time frame, that kind of gives, you know, there's a little bit of wiggle room there.
Mhm.
So instead of April 1st, it would be
Yeah,
May 1st.
I guess the concern, if you're waiting to March, proposal due date is April 1.
These are all arbitrary, I just
Okay,
created the sheet.
okay.
Yeah.
So we're
You
talking
would have to
You're gonna have to
shut
build a
we're
little.
discussing moving
Yeah.
back to May
Build a little
1st.
Moving everything
Yeah.
back to another 30 days.
Yeah,
I guess that's what I'm.
The award period June 1, I think you got time to work.
yeah.
Mhm.
But this may require a little bit of additional time on our part to assist with this process and so, yeah,
Okay.
Well,
if we need to.
I'm going to entertain a motion as far as the timeline that we hope to approve these documents at our March meeting, and that the tentative timeline start May 1st.
May 1st.
Mhm.
You know,
Mhm.
And
Adjust it
everything
accordingly.
Accordingly, yeah.
and that the award periods will end in 2025. Someone like to make that motion?
I'll make a motion.
For a second?
Second.
All in favor?
Aye.
Opposed?
Awesome. Oh, moving forward.
Mhm.
Good work.
Thank you.
Good work.
That's a lot of work. Got support people. It's awesome. Okay, let's see here. Our baseline reporting is due at the end of this month. It's easy peasy, so no stress there. And that is the last thing I have to say about Health First Indiana. Does anybody have any questions that I can answer? And we kind of dialogue the whole time, but I'm happy to answer any other questions for Health First Indiana.
Okay, so what all are you reporting on the baseline? All of these various areas where we stand?
Yes, all the KPI areas, so, there's the 16 different core service areas, and then there's 1 or 2 KPIs that you have to reach in each area, and so it's just yes or no questions. Are you doing this? Are you not?
So it's just what we're doing currently.
Right, yeah, to kind of set that baseline.
And could you send that report to us
Sure,
also?
yeah.
That'd be helpful.
Public Health Day is Thursday, February 22nd. I am going to take a few people with me to the State House for that. There'll be some legislative talks. I'm sure the State Health Commissioner will be there kind of discussing some things. They've encouraged us to set up appointments with legislators. I have not done that, but I'm going to kind of observe and see how things go. I don't have anything specific that I want to talk about. I just kind of want to take it all in. Then I have some program updates. So I gave you guys an org chart that just kind of shows the layout of everything. I tried to update whose contract and the structure of everything. The dotted lines show contract employees. That was a new feature that I added from our previous contract because I think it kind of helps with that visual a little bit. And then you can kind of see kind of who Dan is in charge of, and then everything else there. I also have a contact list. I know I provided it to Mark and Dr. Swander just so that they had that information, but I can give you guys the contact list as well if you want that for the staff, just to have people's titles and extensions and things like that, if that's something you're interested in. For the maternal and child health program, we are extending an offer to our part-time femur medical assistant. We did 3 interviews for that position, and are really excited about the lady that we're offering that position to. Then I kind of mentioned this already, at the beginning of the month we found out that the lead grant will not be renewing, so that'll be over in June of 2024. The funding for that program was a part-time environmentalist position and a part-time public health nurse position, which have both been vacant since December of 2023. We have not filled them. So we're not going to be hurting, with that funding kind of ending there. The account itself is currently negative, but we are waiting for reimbursement for at least 3 months worth of claims that have been sent to the state. And I just checked that this morning, so.
So will we be on the positive side if those
Yeah.
claims are paid?
Yes, yeah. I think the last claim that was paid was like October or something, so we've got a lot of money that the state health still has to send us for that account.
And Tim is very good about keeping me updated
Yeah.
on whatever's happening with that grant.
Is the intent to fill these positions with what we were calling contracted employees?
No, I assumed that they would have been filled. Both of those positions were originally county employees. Both the part-time environmentalist and the part-time public health nurse were county employees. We did not fill them when they became vacant in December. And now that I know that that grant is ending, that was paying for those positions, I'm not planning on filling them.
But what impact on services is that those vacancies have?
So we have a full-time environmentalist and a full-time public health nurse that are both providing those services right now. We have a really, really high lead caseload because of the lowering of the threshold for lead blood levels in last January. And then there's legislation that's lowering the levels for lead soil testing, I think is what it is. That's just something I've recently heard, so I'm not sure about the details on that. But it seems kind of backwards to me, but they're lowering the thresholds across the board, but taking the funding away.
Yeah,
Oh, that's
exactly.
great.
Yeah. So I think last time I checked, we had 63 open lead cases for kiddos, and so that requires environmental assessments. We're talking to parents about nutrition. Are we eating lead paint chips? Are we, where is this exposure happening? What education can we do? Things like that. We have one of the highest lead caseloads in terms of, our per capita population.
But have we been able to keep up?
Yes, yeah, we're keeping up. Crystal, who's our full-time public health nurse, just started that role in December, when she transitioned from a part-time position to a full-time position. That's when the position part-time became vacant. And that's when she took on the lead stuff. So there was a little bit of a learning curve with training. So we got behind just slightly because of her training time. But she's catching up now. With the risk assessments and all that.
So are we still planning to fill those positions, or are we finding that we don't need to fill those positions?
I know that Dan's not planning on filling the part-time environmentalist position because we just got the new full-time environmentalist. He's got all of his bases covered. I think ultimately we could benefit from a part-time public health nurse because of the high lead case level, and some other kind of case investigation stuff that we do. I don't have it in a budget anywhere right now though, because of this grant ending.
So perhaps more to come on that.
Yeah, if you want me to kind of look at some things, I can certainly bring that up again.
There's nothing in this new funding from the state that assumed that to be picked up there, huh?
No, yeah, because we found out after the fact,
I was looking,
unfortunately.
see.
Emergency preparedness update. We partnered with the sheriff's office and Commissioner Dwanger to assist in outfitting AEDs into their fleet. We were able to assist in purchasing 15 AEDs as well as batteries and pads as part of our emergency preparedness funding. So this was ensuring that their entire fleet now has AEDs to be able to provide that service. We've been discussing now a training plan for county employees to be able to properly use those AEDs out in the field. So that was cool and kind of exciting that we were able to partner with another department. Harm reduction. So the suicide and overdose fatality review coordinator position was mine. So I was doing the suicide and overdose fatality reviews, kind of reviewing cases with an interdisciplinary team throughout the entire county, and talking about where are we having gaps in care, so what can we do. And so that position is now going to be transitioned to one of our harm reduction employees. And so that process is, she's being oriented and trained by the staff, or by the state right now. Peggy, yeah.
Okay.
And then,
Do we still have a meeting scheduled?
no, we're not going to, but I need to send out an
Okay,
email for
because
that.
I hadn't seen something. so-
No,
all right,
the
cool.
state just recommended it on Friday to
Okay.
kind of take a little bit more time.
Okay.
We are, this was mentioned a little bit, but partnering with Bridges for Life to host their AmeriCorps member, and then we also have an intern from Ivy Tech who's getting an addiction certificate that's been helping out with some of our harm reduction stuff. We recently restarted our testing, STI, STD testing with Ball State. They've asked us to come every 2 weeks, so Delaware County is one of our counties for our service area for our harm reduction HIV prevention grant. And we have really hit the ground running. It was way, way busier than we expected the first time. So that the first day that we went was February 8th, and it was busy. So I think we're going to send 2 people next time instead of just 1. School liaison and public health nurse. There was just over a 28% absence rate at Western Wayne Elementary in the second week of February. So our school liaison, public health nurse, their school nurse, and their admin team, as well as the state epidemiologist, kind of partnered up to determine that we needed to close the school for 2 days in order to do some infection control and sanitation. So it's a really nice group effort to kind of see that process happen exactly like it's supposed to. And my team did awesome. I was so proud of how they kind of worked together. Really excellent communication. I think I got an email like every 2 hours on what the percentage of absence rate was. You know, if 3 kids got sent home, I got another email. So that was excellent. And they're doing a lot better as far as I understand now. So that's good. And then I had an immunization update here. So seasonal immunization rates are slowing. Mobile clinics are being less utilized. And we're in the process of extrapolating some data to kind of determine what our appropriate adjustments are to be able to make sure we're serving the public as best as we can, keep us immunized, not necessarily keep our immunization numbers high, but keep immunization rates where they should be. And that's all I have.
We started doing tattoo parlor inspections, or where do we stand on that?
So the employee that will be doing that just started on Monday of last week. So I saw Dan kind of introducing him to people. Had him in the mobile unit, kind of showing him some different things. I don't think that the inspections have started yet, but he's being oriented, and I know that he's
Do
going
we
to
have an ordinance on that?
I don't know. Do you know, Jeff? Do we have a specific ordinance for the tattoo and eyelash extension? I don't think that there is. I think we're going
Not
with
that
state
I'm aware of.
protocol. Okay. I think we're just following state guidelines. But Dan would be able to speak on that better.
Any other questions? On safety pins, I noticed there's 2 vacancies there.
Yeah, that's kind of the next step in the process. So I have, with the maternal and child health department, there's 4 positions, and I have just gotten 1 and 2 done, so that's 3 and 4 that I need to start interviewing for.
Any other old business?
I'm just curious to know if I may ask Ms. Becca Angie, as we are transitioning and as we are searching for executive director, as you all are quote unquote holding down the fort, is there anything as board members that we could do in the immediacy of things to be of support through this transition of what the gentleman referenced as far as just having that consultation organizational group or entity? It makes a big difference when you're first trying to get a handle of things.
I am all for efficiency, so I think any sort of like training or efficiency program, SWOT analysis, I love it. I think that I'm more than willing to take any sort of feedback and run with it. I think there's been a little bit of miscommunication, and we are sometimes repeatedly asked for the same things, and so that's a little bit frustrating. But I think we're both more than willing to provide anything that we're asked for.
Absolutely.
It's not always in the time frame that is hoped for. As far as support goes,
Think about it.
yeah. Okay.
Yeah, we'll be here for a
Thank
while,
you.
as well as you all. But yeah, just as you all are going through, I just advise you and suggest that you take notation so as to improve upon efficiencies, effectiveness. But when you're in it, and you're aligning systems, it can be challenging. But stay the course, and we're behind you.
Thank you.
Any new business?
Briefly, as if your jobs aren't hard enough, the government is helping us out. That's not exactly accurate. We have, the Department of Labor has issued a new rule that will help determine whether positions are classified as employees or independent contractors. And obviously, this is an issue that this department has faced over the years. And I suspect that our clean record is more the result of our good fortune than our good behavior, but that's okay. It's going to make it more difficult to have people classified as independent contractors. That's the sum and substance of it. The Trump administration had passed a rule that was never officially promulgated that was more employer friendly. This is a six-point test that is likely to, like I said, make it more difficult to qualify. So we're just going to have to take a good look at each position. I don't see county council having any type of epiphany to where they're going to give you more money for employees. So we're just going to have to try to create the tightest document we can create to create the best contractual relationship we can, and recognize that we are probably in an area that's going to be court tested, hopefully not by us, let somebody else be the guinea pig. And just have to be vigilant, I guess, is all I can say. Certainly the fact that we may have funding sources is gonna help the issues. But it's been a problem, and it's continuing a problem. The rule goes into effect March 11th. It was published in the Federal Register on January 10th. I've seen summaries of it. I basically bite the bullet, go into the Federal Register, download the actual rule, and take a deep dive into it. But the summaries are pretty straightforward. Makes sense. So hopefully the rule will be workable.
Have you had a chance to look at that independent contractor sent you?
Pardon?
I sent an independent.
Oh, that one was easy. That's one I drafted last year.
Okay,
That was for a
alright.
position.
I found it on the computer.
That was
so
a
I thought, I'll
physician
just fire
assistant.
this
Those
over there.
positions are probably going based on the skill required for the position itself. And but the factors that go into it are, look at the situation, the worker's opportunity for profit or loss. Well, if you're getting paid by the hour, there's not much chance of loss. The investments made by the worker versus the potential employer, who's providing equipment, what have you. Degree of permanence of the work relationship, we typically have short-term agreements, so that's helped. And degree of control the employer has over the work, certainly that helps when dealing with the medical care provider. And the extent to which the work performed is integral to the employer's business. Well, all this stuff is integral to our business, so I don't know how, I don't know what the indicators are. And then the use of the worker's skill and initiative, so it's somewhat fuzzy, touchy-feely, but we'll have some guidance, I'm sure, coming out.
Do you anticipate that there'll be big changes to that, the one that's currently, or the?
Well, you sent me a template and you sent me an actual contract. The actual contract is pretty clean because it was a physician assistant.
Yeah.
The template is going to have to be massaged to the position. So when you get a position, you know that you want to put something together, let me look at it, and then I'll call you and we'll talk about the job description itself and what it entails. And again, we're on a spectrum here. I think the best we can do is try to create the best, tightest document that have loss mitigation, if you will. But we're never going to eliminate the potential.
Okay, awesome, thank you.
Any other questions?
You said that's March?
The rule goes into effect March 11th. It's out for public comment now, but if they promulgate it, they don't
Let's
listen.
change.
Next meeting,
We did have a question
Yes,
about
yeah,
that.
I'm sorry. Next meeting, so we are working in partnership with another agency right now, and there's a tour scheduled in Columbus, is that right? That I would really like to be a part of. Is there a way that we could make the Board of Health meeting on another day?
let's see. Well, we could meet a week earlier.
Do you think that'll give you enough time to review the documents for the
Well,
request
we've
for
already got the
proposal?
documents, right? I would think so.
Okay.
And another reason maybe to move it up is because it gives us a timeline.
Yeah.
It improves the timeline.
Right, if we would need to meet again or
Yeah.
meet in a smaller group to go over something, okay.
Okay,
So we move it to the 12th?
sure.
That works for everyone, wonderful.
Awesome, thank you so much.
I had a haircut scheduled that day, but I'll
Sorry.
I think you got plenty of time.
All right.
And still at noon, right? Dr. Ryder?
Pardon?
At 12 p.m.?
Yes.
Okay.
Wonderful, thank you so much. And I'll send out an email to confirm
Okay.
that.
Awesome,
Perfect.
thank you. Thanks for the reminder.
Okay. Is there a motion to adjourn?
So moved.
Second.
Second.
All in favor?
Aye.
Opposed? Thank you, everyone.
Thank you.